A slew of major events next month, including the Super Bowl, while they're fueling concerns of a potential super spreader. Tonight, we spoke with Dr. Michael Daignault, Providence St. Joseph Medical Center in Burbank. He gave us some perspective about that issue and other topics related to the pandemic.
I think we're definitely in a good place. I mean, if you look at LA County wide, cases have dropped about 45% over the last week. And then today we only had 16,000 new cases. Again, that's delays in weekend reporting, but there's definitely an overall downward trend. Hospitalizations are coming down by almost 100 a day countywide. And we're seeing that in my hospital. We had a peak of maybe 111 COVID admissions as of last week. And then this weekend, I checked last night, it was down to about 70, 80. So, we're definitely making a lot of progress. And I think we're trying to balance the tail end of an Omicron surge plus having all these events is certainly challenging. And I think we have to look at these events like we looked at the holidays. So I think we need to take precautions in the same way that we did holidays. And I like to sort of divide it up into two ways. So we have the large scale events that occur at SoFi Stadium this weekend and then perhaps the Super Bowl. And I think we're doing the best thing possible and to require proof of vaccination or a negative antigen or PCR test prior to arrival. And then you have to think, where are fans coming from, right? So fans are coming from San Francisco, which has one of the highest vaccination rates in that county, perhaps in the rest of the country. I mean, they certainly have more people fully vaccinated in LA County.
What is your message? I know we keep saying social distance, maybe do things outside, but what is just your message to people who are gathering, maybe aren't vaccinated, aren't boosted, and you're seeing these cases for the last 2 years, you're treating these patients. So what is really your message? How do you get through to people who still haven't listened?
In the ER in the last year since we've had vaccinated, I've only had to admit one patient who was vaccinated and they were partially vaccinated. I've only had to admit one patient with COVID who was vaccinated, and even that patient with just one dose had very minimal symptoms. And so, throughout this pandemic, and especially in the last year of having vaccines available, the people that are getting admitted to the hospital time and again are unvaccinated. And I think people need to know that it's not too late. Even if you can just get one dose of a vaccine, it does provide a fair amount of protection against severe illness, against hospitalization.
Are you guys in a hopeful space at your hospital when it does come to hospitalizations and COVID?
Yeah, I think that hospitalizations are coming down across the county, and certainly at our own hospital, we're starting to see them level off and come down. And at the same time, a lot of our healthcare workers that had a breakthrough infection with Omicron earlier in the month, right after the holidays, are coming back. So we're starting to see staff strengthening up again, which is great, because I really want to see elective procedures and surgeries come back. That's very important that we continue to provide that community service for people that need these procedures. And so, I think we're going to continue to see a downturn in hospitalizations for sure.